Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is June 8, 2025. This video is on a JAMA ophthalmology paper published online on June 5, 2025, titled Glucagon-like peptide 1 receptor agonists and the risk of neovascular age-related macular degeneration, or GLP-1 receptor agonists and macular degeneration. And there was an accompanying editorial titled Should we be concerned about GLP-1 receptor agonists, from Brian Vanderbeek at UPenn. Background: GLP-1 and the aging eye. Neovascular macular degeneration is a leading cause of irreversible blindness. GLP-1 receptor agonists used for diabetes and obesity are increasingly being prescribed. GLP-1 receptors are found in the retina. Concerns have arisen over their long-term effects on vision. This was a population-based approach, a retrospective cohort study using data from Ontario, Canada between 2020 to 2023. 139,000 patients with diabetes aged above the age of 66 years were matched 1:2, exposed versus unexposed. Exposure was defined as equal to or greater than 6 months use of GLP-1 receptor agonists. The outcome was incident neovascular age-onset macular degeneration, identified via diagnosis codes and anti-VEGF injection billing codes. The analysis they used, propensity score matching and Cox proportional hazards modeling. What did they find? They found a clear signal of risk. 0.2% were exposed versus 0.1% unexposed. Adjusted hazard ratio 2.21 with a p-value of 0.001. The risk increased with the duration of exposure, hazard ratio greater than 3 for 30 months. Additional risk factors: older age, hazard ratio 1.12, and a history of stroke, hazard ratio 1.96. Limitation: no data on dose, smoking, sun exposure, observational design of the study, and short follow-up 2.4 years. Key takeaways: first, large-scale evidence linking systemic GLP-1 agonist use to increase risk of neovascular age-onset macular degeneration. Risk appears duration-dependent and may involve VEGF-linked pathways. The authors argue there is an urgent need for mechanistic studies and stratified risk-benefit assessments. Clinicians should monitor visual symptoms and consider ophthalmologic evaluation in high-risk patients. In the accompanying editorial, which summarized the study, the editorial insights were the mechanism may involve VEGF upregulation, and rapid glucose lowering might induce hypoxia-driven changes. The implication: though the absolute risk remains low, 0.11%, clinicians should monitor for ocular symptoms in long-term GLP-1 receptor agonist users, especially older adults with pre-existing eye disease. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.